A very good afternoon to all the viewers. So, we are back with a live session. So, myself, Dr. Lisa Basumatari, I'm a clinical pharmacist at SL Raheja Hospital, a Fortis associate. I welcome you all. So, today's topic is we'll be understanding what is osteoporosis and what is causes, symptoms, and prevention. So, I am glad to welcome Dr. Anup Dhamankaukar. So Dr. Anup Dhamankaukar is consultant joint replacement and orthopedic surgeon at Esther Raheja Hospital, a Fortis associate. He did his fellowship at Advanced Joint Replacement Fellowship from Liverpool, UK, Hamburg, Germany, and Seoul, South Korea. He did his MBBS from St. G.S. Medical College and KEM Hospital, Parel, Mumbai. He also did his master's in orthopedics from Lokmanya Tilak Municipal Medical College and General Hospital, Sion, Mumbai. He was a faculty head at Lokmanya Tilak Municipal Medical College and General Hospital, Sion, Mumbai for over 6.5 years. He has over 42 international publication in peer-reviewed journal and his specialization is into joint preservation and joint replacement surgeries. So we welcome you with wholeheartedly, and we are feeling very great to have you here. Yeah, so we welcome you.
Thank you so much, Dr. Lisa, for the kind introduction. It's always my pleasure and privilege to be a part of these interactions, which really hope to dispel a lot of misconceptions in our population and also educate our patients to a large extent. Thank you for the kind introduction.
Yes, so we can start with our questions, which viewers has. So yes, so the very first question is, sir, what is osteoporosis?
Right. So, osteoporosis by definition means your bone mineral density becomes very low. What does that mean is your bone quality actually becomes quite weak. So, they are more likely to fracture. It's like having a metal solid ball, which is very solid and strong. Vis-a-vis that, you have got a wire mesh, so that can crumple, that can bend. It is not very stable. So that porosity of bone is basically increased in osteoporosis. And for this reason, what I would say is we don't compare our bones with something like a metal ball, which normally most people do. That how hard are bones? Now understand that however hard bones may be, it's a living tissue, it's an organ. As most things in life, it's like a tug of war. Now, when we think of bone as a living tissue, it's always a tug of war between bone formation and bone resorption, that is, absorption of bone. Okay, so whenever you have more of bone formation rather than bone resorption, you will have strengthening of bone. The moment the balance tips over to having more of resorption, or when your bone getting resorbed is faster, you will have osteoporosis because then your bones become fragile because it's an outpacing between bone resorption, which is weakening the bone, vis-a-vis the bone formation process. So therefore, it's always an interplay of these two factors which determines which direction your bone health is, towards osteoporosis or towards good bone health. So that is the definition of osteoporosis: weakening of bone with increased porosity of bone, which leads to fractures because of increased bony resorption that happens over a period of time.
Correct. Yes, truly said. Sir, is it same as osteoarthritis?
Again, a very common misconception. That's what most people have. They almost interuse. It's an interchangeably used terminology, osteoporosis and osteoarthritis. Well, we need to understand that osteoarthritis can happen in osteoporotic or patients with normal bone density. Osteoarthritis only means it's a wear and tear of the joints, which leads to pain, stiffness, and decreased range of motion. So it is usually typically a joint pain because of degenerative arthropathy, because of excessive usage, etc. Whereas when we talk of osteoporosis, it affects most bones in the body. So it's like a global phenomena. It's not only limiting itself to joints. Okay, so it's wherever you have bones which are weak, you will throw up with symptoms of osteoporosis. So that's the basic difference between osteoarthritis, which can happen in osteoporotic or normal bone density patient because of pure wear and tear. So essentially, when you have osteoarthritis in elderly patients, they may tend to have osteoporosis more. But you may have osteoporosis without a symptom of arthritis also. Okay, so those are two different concepts. We'll not mix them up.
Yes, okay. So, sir, like, what are the risk factors of the same then? Like for osteoporosis, what are the risk factors?
Right. Very good question. I think we are living and sitting on a sitting epidemic of osteoporosis. And why do I say that? Is because our lifestyles have changed dramatically. We are having more people working from home, no exercises, no outdoor games. Even our kids are hooked on to online classes or online gaming. There's lack of good nutrition. We are relying a lot of fast foods, which are highly deleterious to bone health. And these fast foods are basically what is going to preempt what I see as a osteoporotic epidemic. Why do I say that? Is because when we relate ourselves to risk factors for osteoporosis, there's this concept of peak bone mass. Now, what is peak bone mass is the maximum high quality of bone that is produced in an entire adult through his lifestyle is what you achieve usually between 25 to 30 years of age. As I mentioned, it's like a tug of war. So, in the early years of life, your bone formation outpaces bone resorption to a very large extent. Hence, in the earlier part of life, you tend to have good formation of bone, and therefore, it's like a nice bell graph in which you have a peak of your bone health. Okay, that peak of your bone health is called the peak bone mass. Now, this peak bone mass is different for different people. So, if I have a peak bone mass which is quite high in my early days of life, it's very unlikely to have osteoporosis later on in life. But if I have my peak bone mass, which is very low in my young adult age, my chances of osteoporosis dramatically increase. So the first risk factor that we need to understand is your peak bone mass is what we need to target, and that planning, like your investments, that's what we do from the beginning, is what we need to invest in our bone health from the beginning. So train your kids to have a good active lifestyle. Let them have good calcium-rich diet. Let them have good supplements. Let them not eat fast foods. Let them be engaged into outdoor games. So all these are going to be your investment for their future bone health, because all these activities will help them achieve a high peak bone mass. Therefore, they will be less likely for an osteoporosis event later on. When we talk of definitions of osteoporosis, there are three types. Type 1 osteoporosis is when we see in commonly in postmenopausal women, when their estrogen levels goes down and they are susceptible to osteoporosis because their bone resorption increases as compared to bone formation. The second type of osteoporosis is senile osteoporosis, because that's when your osteoblast or bone forming capacity itself goes down, okay, because of age. So that is senile osteoporosis, usually beyond 65 to 70 years of age. And type 3 osteoporosis is one which is secondary osteoporosis. Now, this can happen because of intake of a large number of medicines. We've heard of people taking long duration of corticosteroids, patients with hyperparathyroidism or endocrine disorders, patients with malabsorption syndromes where their absorption of calcium itself goes low, or in patients who are on anticonvulsants or on long-term heparin, their bone health, or on autoimmune disorders like rheumatoid arthritis, they are predisposed to osteoporosis because their bone resorption goes quite low. Also, their quality of life, their weight-bearing status, everything is a little compromised. So that is type 3 type of osteoporosis. So all in all, you need to understand that you need to have good weight-bearing exercises, good diet. You need to have a peak bone mass planned up early for our kids as well, or when we are actively working. That is a time when we don't think of osteoporosis. When I'm very busy in the peak of my life, I'm busy with my desk job, I'm working for 20 hours a day, but that may not work in the long term for you as far as your bone health goes. So those are the risk factors.
Yes, correctly said. That's what, like, it's very important that we priorly we see all these factors and we should take into consideration so not to have in future such problems. So like start going outside and do activity, not just sit at home and use phone. And for kids also, just parents should force them and go do some physical activity, play some games, not inside home. So yes, even the diet matters a lot. So prevention is better than cure, of course. This whole future investment, rightly said. Yeah. So we move on to next question. So sir, how do we diagnose it?
Okay, so again, diagnosis comes when we are going to seek for it. Okay, that's the common premonition. Usually, most patients with osteoporosis, they just grow up with a fracture. Now, these fractures are called pathological fractures. Now, a normal bone can fracture if it has severe trauma. Okay, that's a normal fracture. A pathological fracture is when a normal episode, like sitting in the chair or climbing downstairs, a normal event which is not really a high intensity trauma, fractures a bone which is very weak. That's called a pathological fracture. So most of these patients present to us as a pathological osteoporotic fracture, typically in the spine. So let's say if they are getting up suddenly from the sleeping position, or they sit down hard on the chair, they suddenly get acute mid back pain or low back pain, and that's a presentation of osteoporotic vertebral fracture. Second possibility is an osteoporotic hip fracture, which is again very common. So it's like they're just standing on the near the counter cooking in the kitchen, and they turn around. They have a small slippage that happens because of some water being on the floor, and they throw up with a hip fracture. Now all these are osteoporotic by definition osteoporotic bony fractures, and that's how they present. Also, it's important to know that if you have an episode where your first degree relative has had these osteoporotic fractures, you may be predisposed to that. So again, there's something called a crack score, which determines your chances of 10-year osteoporosis or pathological osteoporotic fractures in the next 10 years. It's a score that has come up. That's called the FRAC score, which takes into account your medical condition, your BMI, whether you have had first degree relatives, your parents who have had fractures, any kind of pains or medicines that you have been on. So those are the factors is what they take into account, and from 40 years on, they calculate your future chance of osteoporosis or osteoporotic fractures. That is one. Secondly, the globally accepted definition or diagnosis of osteoporosis is based only on bone mineral density, not X-rays alone. So X-rays, we may have an idea that the patient is suffering from osteopenia, which is lack of bone sclerosis or calcification on the X-ray. But by definition, the definition of osteoporosis is your bone mineral density being less than minus 2.5 standard deviation from the average young adults, which is called the T score. So T score defines a comparison between your bone mineral density to the density of young adults, okay, which are not age matched. So if you have any density which is less than minus 2.5, like minus 3, minus 4, you have a proven osteoporosis. Osteopenia is when your standard deviation from the T score is between 0 to minus 2.5. Anything less than that is proven osteoporosis. Okay, that's how we define it. Generally, what they take into account for these bone mineral densities is your bone mineral density in the spine, hip, and distal radius. There have been papers that suggest that most depictive of them are the hips and the spine bone mineral density, and that's what we usually define osteoporosis from. Okay, so osteoporosis, osteopenia, and good bone health. That's how we would classify the entire spectrum as. Again, what we need to understand is it's not only diagnosis, but let's say if we have a minus 3.5 or a minus 4 of BMD in a patient who is very low BMI, who is diabetic, who is alcoholic, or who is a smoker, all these are risk factors for osteoporosis. So if we have these put together, we can calculate a FRAC score which generates this possibility of future osteoporosis or a hip fracture in the next 10 years. Also, any one percentage or one standard deviation increase in your osteoporosis increases your chances of future fractures by 50%. So this is the importance of knowing where we stand now, and we'll go on as we go on. There'll be a lot of talk on what medicines do we take, how do we judge our improvement, etc. So these are the diagnostic tools towards knowing whether you're osteoporotic or not.
Okay, sir. Yeah. Sir, also just let us know what all preventive measures we can take for osteoporosis.
Very good question, I guess. So going back to the tug of war, it comes to that. We need to have more bone formation than bone resorption. So knowing the risk factors, we need to avoid or limit ourselves to whatever smoking or alcohol consumption that we do, because these are corrective measures. These are not we are not born with them. So we can definitely take those measures in our early youth. Have a good diet. So I would say, as I mentioned, start preparing from young adult stage. Have good supplements of calcium, vitamin D3 during your young days as well. That is a preventive measure. Why is because the moment we are not going to have a good diet, we cannot have good supplements or nutrition to feed our bones. Okay, so we need to have a good amount of calcium and vitamin D3. Both are important. Again, there have been papers saying that isolated calcium or vitamin D do not help as much, but a concurrent therapy of calcium daily in young adults up to 500 to 1000 milligrams of calcium daily, whereas 60,000 international units of vitamin D for about 8 to 12 weeks, and then supplement that with monthly vitamin D 60,000 units. That's what we can continue as a chronic therapy. So both of them are important and supplementary to good bone resorption and deposition of bone into your calcium onto your bones. So that is one. Secondly, if we know of physics, biomechanics, there's something called a Wolff's law. So we need to engage into bone weight bearing exercises. So the moment we see our adults or our elderly patients with a lot of bone pain, we say that please do not go for a walk, or please take rest, let them sit back. We need a lot of attendance. In fact, that may worsen them. Okay, and this is something that is absolutely important. So we need to have these elderly patients walking. They may have pain, we can have treatment, but they have to walk. The moment patients or bones do not walk, they will just dissolve with their bones. Okay, so it's like you don't go to the gym, your muscles will be frail. The moment you go to your muscles, you need some kind of weight bearing exercises to build up your muscle mass, similarly, or bone mass. So, for bone and muscle health, both calcium and vitamin D3 are important. So, engage into good weight bearing exercises. And by definition, weight bearing exercises that are recommended are up to half an hour of walking or weight bearing exercises 4 times a week. Calcium requirements I've already told, vitamin D3 requirements I've already told, and avoidance from all these habits of alcohol consumption, smoking, etc. That will really go a long way. That is a good preventive measures. Right? Then we come to when we diagnose a patient with osteoporosis, maybe through a fracture, for which they come with with a hip fracture or a spine fracture. We need to always treat their osteoporosis and not only that fracture, because that they can come back with the fractures at other sites or other levels, or or some other bones. Okay, so always have a treatment for the fracture, but also for osteoporosis. Now, what do we have in store for osteoporosis treatment at this stage? We supplement them with calcium. Usually, in these particular patients, our calcium daily requirements, they may go up to 1250 milligrams of calcium daily. We need to supplement with their vitamin D levels. Usually have vitamin D levels which are serially marked or measured on the blood levels. Make sure that you don't supplement them more than what is normal. That is also deleterious. It's a fat soluble vitamin. So have calcium, vitamin D3 supplements. Then we have something called bisphosphonates for treating osteoporosis, which is proven with a BMD. And what do we do with bisphosphonates? They are agents or drugs which prevent resorption. So the moment you lug your losses of your bone resorption, you will have increase in bone health. Okay, so that's how we would work on bisphosphonates. There is again an entity called teriparatide. It is an injectable medicine to be injected subcut. It's below the skin. As you have insulin injections, you have these injections that are given below the skin. They are to be taken daily for up to 6 months to 2 years. Now, what these medicines do is they are analogous to your parathormone. So it confuses the body that your resorptive element, which is parathormone, which is supposed to resorb the bone, and this molecule is mimicking that. So it blocks that particular receptor in the body. Therefore, your biomechanical feedback is such that your parathormone levels go down. Okay, the moment they go down, your bone resorption decreases and your bone formation or osteoblastic activity increases. That's how this particular injection works out. So we have talked about anti-resorptive therapy, that is bisphosphonates, then bone formation activity by means of teriparatide, which is to be taken for at least 6 months up to 2 years. We just need to monitor the renal function tests of patients before we can embark onto this therapy. And the other injections that have been used are denosumab. They are again working on an anti-resorptive pathway in which bone resorption actually goes down to increase bone health. Okay, so these are different methods by which we can treat osteoporosis. Apart from that, we have hormone replacement therapy in postmenopausal women, which actually help to improve bone health. And also, we go on back to our lifestyle modifications, which really do a lot of good work in improving our bone health in treating osteoporosis.
Yes. So sir has also covered the treatment part also. I hope all the viewers got answered to the most of the questions. Even if like they have some other questions as well, they can anytime contact, like they can anytime reach SL Raheja Hospital. So yeah, so I would like to conclude the session. So thank you very much for today for the osteoporosis session. And yeah, it is very much important that you need to take care of yourself. You need to start working from the starting age itself, so that not to have complications in future. So your social life, your diet intake, and all sort of things are very much important for your health. Of course, health is wealth. So you should give priority to your health first. So that's what. So sir, thank you so much again, Dr. Anup. Thank you so much for today's session. Thank you. Thank you,
Thank you so
viewers.
much for having me. It was indeed a pleasure interacting with you and our lovely audience. Wish them the best of bone health.
Yeah, great. Thank you so much.
Thank you.